So I want to thank the organizers for putting this workshop together. It's clear that a lot of people have looked forward to this and that there is a big demand in terms of support with grant writing. I've personally really enjoyed the first two sessions. I think it was a really nice mix of very practical kind of hands-on and detailed advice, as well as some bigger picture issues. So I've been asked to share with you some of my tips and some of my experience with regards to building collaborative proposals. And I'm going to start off maybe a bit more high level than the previous presenters, but I think that framing and context is always incredibly important. And as most of you will know, we've seen a rise in scale and scope of collaborative global health research. And this is due to a variety of reasons. There are scientific factors to explain this interest in global health research, such as new scientific developments and techniques. But some of this is also driven by funding initiatives like the Gates Foundation, like the Wellcome Trust, who are really encouraging different researchers, different research institutions to work together. The event of large data sets becoming available, but also the fact that as researchers, we are addressing health disparities that are better addressed through global initiatives than individual initiatives. So a variety of reasons why we have more now than ever an interest in global health research. But it's very important to realize that research does not exist in a vacuum. And the title of the slide is Parasitic and Parachute Research, and it refers to a type of neocolonial vision of research where researchers parachute into countries to collect data and samples and leave, or have a parasitic approach to research where they don't even come to the countries themselves, but they gather data and samples through different initiatives without actually contributing to any local research strengthening, research development, without really aligning with local or regional priorities. So this is a type of research that is really not what we think about when we think about global health research. And it's important to understand that this type of research does not take into account the complex ecosystems in which research take place. We're talking about history, politics, economic partnerships, and all of this is important, not only when we consider relationships or partnerships between different collaborators, between different researchers, but also when we think about the impact that our research has and the power that our research has to either respond and change or reaffirm certain health inequalities. And so I think this is quite high level, but I think when we consider global health research, when we consider research partnerships and research collaborations, it's really important to keep that in mind. Because it's not only quantity, but it's also quality. So we can look at the number of collaborations. We can boast that we are working as Oxford, for example, across the globe. We can boast that we have 20,000 research collaborations, and this is just an example. This is not, this is hypothetical. But does the amount of collaborations, does the amount of networks that we're part of really say anything about the quality? Does it give an insight into whether these collaborations are equal or fair? Or are we perpetuating certain relationships? And the consequences of perpetuating these relationships could be diverse, but it could go into making sure that things don't change, whether we're talking about publications, whether we're talking about principal investigators, whether we're talking about building that capacity, if it's the same people who are always benefiting, then we can question and ask ourselves, is this fair? And so again, when we are talking about partnerships, when we are talking about collaborations, I think it's really important to not only look at quantity, but to look at quality and to look at whether these partnerships and collaborations continue to perpetuate current inequalities, or whether they're really based on foundations of equality and sustainability for that matter. So that was just to give you a bit of a context to global health collaborations, but why is it so important? Why do we see more and more collaborations, and why does it matter? And so I think that collaborations are important because they enhance scientific quality and innovation. And why is that? Because when you work as a team, when you work with people with a diverse set of skills, with diverse expertise, you can really come at a problem from different angles and give a more comprehensive and rigorous answer to certain questions. But it also stimulates creativity. And we've talked about innovation, we've heard about innovation from the previous presenters as something that is an element that funders look at. And funders want to see novel ways of addressing a question. And I think it's very hard to come up with novel ways of addressing a question if it's just you sitting behind your computer. You have to create an environment where you are stimulated. You have to create an environment where you interact with researchers with different backgrounds, with different skill sets that challenge your assumptions and can really lead you to think about new perspectives to generate novel hypotheses or generate novel methods to answer existing hypotheses. So collaboration matters because it brings different people together that think about things in different ways and that can generate new research questions and new ideas. But it also strengthens research credibility and impact. If you have a group of people or a group of collaborators that are looking at each other's methodology that maybe have different methodological backgrounds, that will help you by cross-checking your ideas, cross-checking your data, and that can help with enhancing your scientific rigor. But working in a bigger team can also help to disseminate your findings and to have a bigger impact. And the word impact is something that we've also heard from the two previous presenters. This is, again, something that funders will look at in terms of what will be the outcomes, what will be the impact of your proposed grant, your proposed research product. So it's not only collaborative publications that often reach a broader audience, but by having a network of collaborators, those collaborators in turn will disseminate their results within their network, and you get a kind of snowball effect of dissemination of your findings and of your impact. And last but not least, it can increase efficiency and productivity. Because if you work across a network, you can share resources and infrastructures. And a very practical example of that is for when my network is looking for partners to, let's say, conduct a clinical trial with, we can offer expertise in clinical monitoring of that trial. And so our expertise in monitoring can be used by all the collaborators. They don't have to develop their own expertise in monitoring, or they don't have to outsource it to CROs that are quite expensive. But no, they can use our monitoring expertise across the network for that clinical trial. And so in sharing resources and infrastructures, that means that you can be more efficient and you can potentially engage in bigger research proposals. It can also accelerate timelines. And this shared infrastructure, shared resources translating into efficiency and productivity is something that funders really like to see. And that's why I put in brackets greater funding potential. Funders like to see that working together, that using of resources, especially if you're working with collaborators that might be funded through the same funder, they like to see that the funding that they have given can amplify impact by making people work together. But so we talked about making sure that your collaborations are not only quantitative, importantly. And so when I talk about quantity, I'm talking about impact, I'm talking about resources, I'm talking about efficiency, but we've also talked about quality. And I want to share with you on the bottom of the slide, you see a link to a publication from Mike Parker and Patricia Kigori, both linked to the Oxford ETOX Institute looking at ethics in global health research. And they wrote a paper called Good and Bad Research Collaborations, Researchers' Views on Science and Ethics in Global Health Research. And they did interviews, they did in-depth interviews, they did focus group discussions to really talk to researchers and ask them what do they thought were factors that were important to successful research collaborations. And they are linked here on the slide. So it's things from active involvement in interesting science. They wanted to do something that they thought was interesting, was cutting edge, effective leadership, capacity building, trust and confidence. So I'm not going to read all of them, but these are clearly more value-driven factors that not always align with words like efficiency, cost efficiency, but they are so important when talking about research collaborations. And it was something that I wanted to share with you because you can have tips, you can have real practical advice, but it's really important to understand that soft skills, values, and norms are elements that are really important when you're talking about establishing collaborations, but also when you're talking about maintaining collaborations and ultimately having successful research collaborations. And so I wanted to translate those concepts into 3 further elements. So why is collaboration important? It builds capacity and it enhances equity. So collaboration helps in trying to not maintain the status quo of having the research always being funded and conducted by the same people in the same regions, such as high-income countries, because the infrastructure is there, because the knowledge is there. Collaboration can help to promote equitable global research. And when you collaborate with certain partners, that can help to support training. You can bring in mentorship in your collaborative proposals. But you can also tackle bigger, large-scale studies. If you bring together multiple sites and people with diverse skill set, people who have expertise in genomics or who have expertise in climate health research. So those types of research proposals are very interesting, but require multiple sites, require a certain participant number, which can be achieved through collaborative approaches. And then last but not least, it can align with ethical and societal responsibilities. If you work with collaboratively with different researchers, they in turn work with different communities. They have to sometimes justify their work to different policymakers, to different stakeholders. They work in different health systems. So by working with different collaborators, you can ensure that your work aligns with these different contexts, with these different health systems. But not only that, it will build trust because people will see that you are working with a variety of partners, a variety of collaborators, and you are promoting equal partnership. You are promoting fair recognition of all contributors. And that is, again, an element that is really important when thinking about collaborations. So Now that we know what type of collaborators we would like ideally and what type of collaborations we ideally would like, how do we now go about that in a practical sense? And there were a few mentions or questions in the Q&A section that I saw that asked, how can I find a collaborator? How can I find a collaborator in a high-income country? How can I find a collaborator with maybe a certain skill set? So I think that first and foremost, it's important to have an idea of what type of proposal that you are aiming for, that you want to develop. And then you should map out the expertise that is required to bring that proposal to a successful outcome. So you outline the expertise, and then you can look at potential collaborators who possess that skill set or that knowledge. And these can be people that you've worked with before, but these could be people that you have not met yet. And how do you come into contact with potential new collaborators? It's through using your existing networks. It's through attending conferences, attending workshops just like these, and really utilize your professional network to meet new potential collaborators. Engage with your peers. Quite often people look for collaborators and they say, oh, but I'm looking for someone in Europe, or I'm looking for someone in the US, or I'm looking for someone in Africa. And they forget that sometimes collaborators can be found much closer to home. So engage with your peers, attend conferences, talk to people, and just see if there are collaborators that might share your potential interest. But you can also use other resources, and AI has popped up in the QA several times. And I think that there is a wealth of information out there on internet. You can use AI. You can use so many different resources to find potential collaborators. If you are developing a project around a certain team, a certain disease, a certain expertise, explore the literature. Look at who has published around that similar topic, and look at who has authored gray literature or peer-reviewed manuscript around that topic, and email them. There is always an email for a corresponding author. Look people up in research databases and reach out. I want to just highlight one of these resources, and you can see there's a picture on the right-hand side of the slide, and it's Pandemic Pact, and it has a really nice overview of different research opportunities and mainly related to pandemic prevention, but very interesting. So as you can see, it delivers over 25 billion in research funding across more than 26,000 grants from 361 global funders. So you can start exploring that as a way to get familiar with how these databases work. But this is just one of the examples. Like I said, there is so much out there that you can use. I put a little star in the bottom, and that's a bit food for thought. I think working with people that you've worked with before, known collaborators, is always a good starting point. But sometimes I have discussions with people and I ask them, why did you put so-and-so on your grant as a collaborator? And their reply will be, well, because we always work together. And I think it is important to have known collaborators because you know what they will contribute, you know how they work, very important. But I also think that it is important to not keep working with the same people just because you've been working with them. They might not have the necessary expertise for this grant. The sites that they work with might not have the best study population for that specific proposal. So I think for each proposal, it's really good to think about, map the expertise. Who do you need? Who would make this grant a success? Who can contribute the necessary expertise, skill set, network to deliver the outputs and ultimately the outcome of your proposal? So just something to keep in mind. The other thing that I've heard before is about starting early with your research proposal. It is the exact same advice for starting collaborations early. It is important to discuss your common goals and interests early, and this is to make sure that everyone is on the same page. And you could think that people have agreed to start this collaboration with you and assume, sometimes wrongfully, that that means you're all on the same page. Well, I can tell you that is not the case, especially, and we'll talk about that later, if you are thinking about having multidisciplinary approaches to a research question. So discuss common goals, discuss interests really early on to ensure that you all have a unified vision. And to help that, you can work on a concept note together. I think it's a really maybe small practical step, but it is so important to develop a concept note jointly, because that will allow you to kind of really have these discussions early on about what are your research questions? What do you think the best objectives are for our research? What do you think the best methodology will be, the best tools? And so it really helps not only to get to know maybe new collaborators, but really to clarify and crystallize the ideas you have, to think about a focused way of thinking about where do you want to go, what is the question that you want to answer, how do you want to answer it, and to make sure that everyone is on that same page. And that will make the whole project lifecycle so much smoother. So having these discussions early on, even if they might not always be easy, will really be so important throughout the project. And the same goes for clarifying roles. Clarifying and defining roles early on is really important, not only because it helps with accountability, but it avoids misunderstandings and it ensures that everyone knows what they have to do to contribute to the success. And again, it is so important to talk about that early on. I put a little star there, food for thought, and you can see the cartoon there that says, "Welcome to the co-authors party, you're number 21." And so when I talk about clarifying roles, I'm not only talking about clarifying roles in terms of who is the lead, who is the co-lead, but really going down to the nitty-gritty level of who is going to help with coordination, who is going to be the person that sets up the weekly calls, but also what about authorships? What about data management? This is part of the responsibilities. And maybe for a junior researcher, it might be difficult to start that conversation, but do it anyway. It is so important to ask about authorships. You want clarity. You want to know what is going to happen later on in the project. It avoids misunderstandings. It avoids really awkward situations or discussions when you have already moved into the project, when you're maybe already drafting a manuscript. Have these discussions early on. It is so, so important. And so I've been asked to talk a bit about designing multi-country projects and designing interdisciplinary projects. And so what I have found as elements of success for designing multi-country projects is leveraging local strengths. So it is really difficult to design a multi-country project when you have an idea and it is an idea or a methodology or an expertise that is not prevalent in those countries, because then you might be seen as someone who is again going to jump in, maybe with their parachute, to come and set up something that might not be necessarily important to local expertise, that might not necessarily strengthen local expertise. So it is so important to understand local context and to utilize that local expertise when you are developing those projects. It's important to foster community support and to make sure that whatever outcomes you have align with local or regional needs. And this alignment with priorities is something that comes back as a second point because it is so important. It is important because your funders will look at whether your research project aligns with local and regional needs. But also you will get stakeholder buy-in, and stakeholders can be your ethics committee members. It could be the regulatory authorities that need to approve your project. It could be your community where you're going to recruit. And the likelihood of getting support and acceptance from all of these different groups is much, much higher when it aligns with their own priorities, when they understand why you are doing certain research. If I am doing research around malaria, for example, or dengue in Vietnam, most people have had that disease themselves already. Most people have had family members that have been affected by that disease. In terms of stakeholders from the government, they understand the burden of disease for their countries. They understand the burden to hospitals, the burden to productivity. And so they understand why research around dengue or malaria would be important. They might be less understanding when you talk about a disease that is maybe more prevalent in high-income countries, or a very rare disease, or a disease that requires drugs that are very, very expensive that you are not planning to make available to the local populations. So aligning with priorities is important. And when designing a multi-country project, which means you have multiple countries, multiple contexts, and multiple priorities, it's really important to think about that at the designing stage. And then ensuring balance, maintaining a balanced approach between participating collaborators. And when I talk about collaborators, this could be countries or regions. So we want to avoid dominance of one collaborator, one region. We want to promote equitable contributions and shared ownership throughout the project. And that's another way where we can ensure that there is this training, this mentorship that I was talking about earlier. And so how do you ensure balance? And again, a bit of food for thought. It's by creating a win-win situation. And I think that researchers quite often don't have that mindset of that maybe competitive or more economical way of thinking, but this win-win mentality and this win-win way of thinking can be really beneficial when you are developing project, because it will make you consider, what am I getting out of this project, but what are other people getting out of this project? And if people feel that they're not getting enough out of this project, then I can assure you that first of all, your project will probably be not as successful as it could be. But second of all, long term, these collaborators might not be persuaded again to work with you in the future. So thinking about what is there to gain for all the collaborators in this project is really important. And it could be that these are different things for different collaborators, but it is important to think about that at the designing stage. All of the elements that I just talked about are equally as important for interdisciplinary project, but we'll touch upon that later. So now I first want to share some real practical tips when you are designing and implementing multi-country projects. When you are designing multi-country projects, communication and planning are crucial. They are important for any project that you design, but when you are talking to people that are in different time zones, to people that speak different languages, to people that have different cultural contexts, which means different public holidays, people might be using different calendars, like in Nepal, for example, planning becomes crucial. Your project will not succeed if you don't have very good, transparent communication and optimal project management and planning. So that is really important. So think about that when you're designing your project, and make sure that you're planning some funding to allow for staff to help with that coordination, to allow for tools to help with planning. So put that in your budget. It will show funders that you are aware of the burden of operational planning when it comes to multi-country projects. So planning helps you think and anticipate. Think about risk management when you are planning these projects. Risk management is good to do in any project, but again, if you are collaborating across multiple countries, sometimes across multiple continents, you really need to think about what could be some of the potential risks that could prevent me from reaching the intended impact in this project. You have internal, external influences. So it is important to think through that, but it is equally important to realize what you have control over and what you have to let go. And I think that the COVID-19 pandemic was a good example of situations where we could not control everything. And so we had to carefully balance what we thought was important and what we would control, as opposed to certain elements or certain things that we just had to let go of. I think defining clear leadership and governance structures, again, is important. If you're doing a research in one country, it's well, let's say, defined. But if you're working across different countries, it is so important to have a good governance structure, to have clear leadership, because very easily things will spin out of control if people are not aware of who is doing what. And clear leadership, people might be duplicating each other's work, or the work might not be done at all because maybe someone is thinking, oh, that's somebody else's job. So really important to have these clear governance structures and roles and responsibilities in place. I talked about communication already. People management communication, so important, and so I think undervalued. I have seen really successful projects really get off the rails because of bad communication, because people were not listening to each other, because people were not showing empathy for each other's context. So don't underestimate the soft skills and the people management. And then last but not least, it's really important to manage expectations towards the team and the funders. And what do I mean by that? I mean that when you are designing multi-country projects, these projects are already very complex, very challenging. So it is really important to set a clear goal and to have a focused outcome and manage expectations. Say, what we are going to do in this project is this and nothing else. So really make sure that you have a focused, well-aligned project and that you don't allow scope creep, which is something I will touch upon later, to come into your project. And that means that scope creep means that the scope of your project is slowly becoming broader. Things start creeping in, and that will make it so much harder to have your project attain their main outcomes, because now you're thinking about all these other things that need to happen. So manage expectations both towards the team and the funders. No, I'm really sorry. I know that you're doing a PhD project, but you cannot just very quickly add on a few questions in our project. You can say that to somebody who's asking in your team, or towards the funders. Yes, we know that we've set this up and we know that we could do X, Y, and Z in addition, but we're not going to do that. And generally, funders will listen to that and actually will respect that and will understand that you know what you're talking about and that you are ensuring that you can meet the outcomes of your project successfully by protecting your time and that level of work that needs to happen to make your project successful. So designing interdisciplinary grants, again, everything I've said about multi-country grants applies here. The communication, the focus, all applies to interdisciplinary grants, but there are a few elements that are, let's say, specific to interdisciplinary grants, because you are integrating diverse fields of research, skills, and expertise. So how to design successful interdisciplinary grants is by designing integrated research questions. What does that mean? That means that you have research questions where all different skills and disciplines are integrated in. And that ensures that everybody feels equally valued. That ensures that everybody contributes equally and effectively. And that is important because diverse disciplinaries have diverse priorities. Each discipline might have its own goals, incentives, expectations. If we think, for example, about publications versus policy influence, take into consideration that you are working with a medical anthropologist versus a health economist. So different expectations. Shared frameworks are very similar. So by building a shared framework, you allow collaborators to align methodologies, understand sometimes very discipline-specific jargon, and have a mutual understanding of the expectations throughout the project. And finally, something that I'm a big fan of is mixed methods. So you're using mixed methods. You can integrate quantitative and qualitative insight for a more holistic and comprehensive understanding of your research question. And this is something that funders like to see. Are you adding a health economic question to the development of your new drug? Do you have a social scientist looking at acceptability of this new drug? So all these different disciplines can really help you to create a much stronger impact in your research proposal. There are some challenges in data compatibility and evaluation of certain metrics. But again, if you think about that from the beginning early on, then this is something that can be overcome. And so to round off, because I think my time is almost up, I just want to leave you with these key takeaways. So collaboration is challenging and is hard, but is so rewarding because it brings with it innovation, it brings with it creativity, it brings with it bigger impact through generalizability, but it can also lead to capacity strengthening, knowledge exchange. It can lead to bigger policy and societal impact, and it has strategic and funding advantages, mainly linked back to operational efficiency and sustainability. And so it is so important to work with people that you align with in terms of ideas. It is so important to think about how you are going to manage different people, different contexts. Communication is crucial to any project. And last but not least, respect. And I'm going to end off here and hand back over to Katrina, I think.